Good morning, everyone. I am Jocelyn Campania from BSN2A2. For today's returns demonstration, we're gonna do an inserting and indwelling urinary catheter for female. Before the catheter insertion, first we're gonna verify the order. Then prepare the materials needed. Good morning, Mom. I am Jess, your student nurse for today. So, Mom, are you Miss Park? Okay. So, Mom, for today's intervention, we're gonna do the catheter insertion. So, this procedure, Mom, will be a little bit painful, but it is tolerable. So, the purpose of this insertion, Mom, is to relieve the urinary retention, to measure the residual urine, and to allow accurate measurement for the urine output. So, that's all, Mom, and please be cooperative with me. Can I ask one question, Mom? Do you have an iodine allergy? Okay, that's great. So let's close the curtain for the patient's privacy and close the door and secure a good lighting for the accuracy of insertion. Position the patient correctly. Assist the patient to recumbent position with the knees bent and then the feet flat on the floor. Then next is to perform the hand hygiene to avoid contamination. And then put the gloves to clean the perineal area. Clean the perineal area with water and soap. Imagine na lang. Let's just imagine. Okay. And then clean it with from top to bottom. And then dry it. After cleaning the perineum area, remove the gloves. And apply hand hygiene again. This procedure is to drape the patient. Next is to open the sterile kit on the bedside table with a sterilization. Okay. Next is to apply the sterile gloves and drape the patient. And then ask the patient to slowly raise her hips. So, Mom, can you slowly raise your hips, Mom? And the next is to put the penetrated drip over the labia. This drip is for the patient's privacy. So prepare the antiseptic solution and then attach the saline-filled syringe to the side port of the catheter. And then inflate the balloon. Okay. After is to deflate the balloon and leave the syringe connected to the port. Is to apply the sterile lubricant to the first 2.5 to 5 centimeter to the catheter tip. Next is to attach the catheter to the drainage system and ensure the drainage bag empty port is clamped. So it's good. Non-dominant hand, identify the meatus by retracting the labia. And then hold this position throughout the procedure. With the sterile dominant hand, clean the meatus with the antiseptic solution, moving from top to bottom, and first do the farthest from you. Clean from the middle. Patient to bear down, then with the sterile dominant hand, slowly insert the catheter into the urethra until urine flows. Just like a pen. Insert the catheter until the until urine flows. Then let's just assume that the urine is already flow. Then advance the catheter 1 to 2 inches more. Do not force the catheter through the urethra. While inserting, ask the patient to take slowly deep breaths until the initial discomfort has passed. So mom, can you please do it with me? Inhale, exhale. Inhale, exhale. Very good. Inhale, exhale. Inhale, exhale. That's great. Hold the catheter with the non-dominant hand, then use the sterile dominant hand to fully inflate the catheter balloon. Then remove the syringe. Gently pull the catheter until resistance is felt. So it is already resistant. Secure the catheter in the patient's inner thigh with securement device. Secure it so that the patient will be comfortable. Tubing is not kinked, and secure the drainage bag to the bed frame below bladder level, but do not resting to the floor. use the used supplies and then remove the gloves. Assist the patient to a comfortable position. So, mom, are you okay? Next is the documentation. So, in documentation, let's check the type and size of the catheter, and then the amount of fluid inserted in the balloon, and then the patient reaction throughout the procedure, and the characteristic of urine, name of person performing the insertion, and the time and date it was completed. That's all for today. For watching.